Welcome to the Burnout Recovery Podcast, a guiding resource dedicated to healthcare professionals on their journey to overcoming burnout. Spearheaded by Dr. Joe Braid, a certified professional coach and rehabilitation physician.
Welcome back to the Burnout Recovery Podcast. My name's Dr. Joe Braid, and I'm delighted to be with you today on a solo episode all around the critical topic that affects all of us in healthcare: psychosocial risk factors in the workplace and how they can contribute to burnout. I'll be sharing both research-backed insights and a personal story that I think many of you will relate to. So just for an update on what's going on in my life at the moment, I am on a 6-week ward cover rehabilitation placement. I guess I'm doing 6 weeks as a consultant locum down the road in Bathurst, and that's just started. I'm through week 1, which has gone really well. And I love having these moments of literally being on the floor, moving between the different wards of not a particularly big hospital, but there is plenty of rehab going on, let me tell you. And it's a different vibe to be doing a brain injury clinic only, which is my usual mainstay. So much more dynamic with a different team set up and lots of new patients to meet and their families and so forth. And I've really enjoyed it so far. I'm looking forward to the next 5 weeks and also sharing some wellbeing talks for lunch and learns with the staff. So that would be great. So a few weeks back, I was lucky enough to attend the Psychosocial Safety in the Health Workplace conference in Sydney, which was a room full of over 100 leaders in healthcare from all around the country and some from New Zealand as well, really brainstorming how we can work on that safety for the clinician in the workplace. It was a really powerful day with the stimulus for discussion coming from a play by the Hush play performers. So the Hush Foundation, organised by or set up by Professor Catherine Crock, a paediatrician from Melbourne. And the play was so emotional. It was delivered by excellent play performers who were not medical themselves at all, but how they grasped the hierarchy, the triggering events, the almost non-communication that happened in some scenarios, and the critical part of the family experience of what happened in this play scenario. It was so powerful. And from that, the whole floor opened up for discussion and what could you do in that scenario? What else can we do? And are things still the same, or have they moved on from there? So I found that a really wonderful day to be a part of. And people have been then saying to me, can you talk a bit more about psychosocial risk factors and what they are? And I thought, since being on the wards, I am more aware of these when I'm sort of in that mix of what goes on in the hospital, that the psychosocial risk factors are somewhat more apparent than in an outpatient setting only. So let's start off without too much storytelling by explaining what we mean by psychosocial risk factors. So these are really aspects of work design, organisation and management that have the potential to cause psychological or physical harm. So yeah, we're probably a lot more aware of what like lifting risk factors are. You can think of that visual that you've got. It takes 2 people to lift this 16-kilo chair or whatever it might be, as opposed to somewhat less visual psychological risk factors. And these really exist at the intersection of how work is structured and how we as humans respond to that structure. Here in Australia, workplace health and safety regulations now recognise these factors as legitimate workplace hazards that employers have a duty to address, and for good reason. Research consistently shows that these factors are major contributors to burnout, particularly in healthcare settings. So let's explore some of the most prevalent risk factors that exist, and also they do relate in my coaching practice as well, with coaching clinicians in a whole range of disciplines across healthcare. Firstly, excessive workload and time pressure. So often healthcare professionals can face unrealistic patient loads, a lot of documentation requirements, and time constraints. And when you're constantly racing against the clock, quality of care can be challenged and your own well-being takes a backseat. And I think this is such an important place to start with, because well-being can actually be a productivity tool. By staying well in yourself, by having those self-care moments, even in the workplace and especially outside of the workplace, you can be more rested. You can be readier for whatever sets up, whatever happens in your clinical day. And an example of how I've been choosing to do that through this week, and as I will continue through the remainder of my locum cover, I've been doing about 20 minutes of movement every morning before I leave at 7:15 after seeing my kids, saying goodbye, and to my husband as well. And then in the evening, I've always been going for a walk after work, and a friend's mum saw me walking around the block a few times. And so then she told her daughter, my friend, and said, hey, do you want to catch up and go for these evening walks that you're doing? So now I've got support and that social community part of thing for my evening walk as well. And so I'm really making the time and the resistance to sort of lie down and just chill and not do too much of the immediate time when I pull in from my drive back from Bathurst. And it has been such a sustainable way to get through the week and really enjoyable as well. So that was excessive workload and time pressures as well, and how well-being is such a priority. And some parts of the workplace can contribute towards your well-being strategy. I would think it's probably more likely that there's more well-being approaches you can do outside of the workplace. How about lack of control and autonomy? So we are increasingly standardized and protocol driven in healthcare, generally with good reason. It improves consistency, but it can also strip us of decision-making authority and clinical judgment. And yes, that can be really challenging for clinicians, I guess, who have been around a lot, and the erosion of professional autonomy making people feel de-skilled and devalued. And if you really don't feel so valued in your workplace and there's a misalignment there, that can certainly be one of the individual risk factors for burnout in the workplace. Poor workplace relationships and support. The quality of our workplace relationships significantly impacts our resilience, our sustainability, and how long we keep persevering. But toxic team dynamics, poor leadership, a lack of psychological safety, and absence of mentorship all contribute to burnout risk. In healthcare, where teamwork is really essential, whether I'm working in my clinic, it's very team-based. We always have a team meeting every day I'm in clinic. And likewise, in the ward, we either have a paper round in the morning or we have a case conference one day per week. But if there's relationship breakdown, that could be particularly damaging. And if leadership fails to address interpersonal conflicts, that can really be almost a poison within a team. So how can you think about your role, the leadership around you, or maybe the leadership you have, any mentorship or supervision you might have in your role, and where you notice you feel either psychologically safe or psychologically unsafe, which is sort of that gut feeling of something doesn't feel right here. Think about how this point might relate to you in the workplace. I've talked about this before, and I will talk about this again. The Schwartz Rounds is this wonderful 1-hour forum for hospital-wide staff, which is tailored to social and emotional well-being. And I've absolutely loved being a facilitator and supporting clinicians and non-clinicians in the workplace of Bathurst Health Service with my fellow co-facilitators. And for me, generally when I'm not facilitating, but sometimes still when I'm facilitating, because of how the room is set up. And in a way, the door is closed and we don't allow people to be wandering in and out. It's set up as a very special sort of space for people to be comfortable to share their emotions that have come up as a result of interactions they've had in the workplace. I confidently say that over the 20 years that I've been in medicine, the most psychologically safe place I've ever felt is in the Schwartz rounds. So delighted we do have that in the hospital that I work in. The next point is role ambiguity and conflict. And look, we can have evolution of the healthcare roles that we're in, sort of upskilling and more responsibility for different roles, and that can create confusion about those responsibilities and boundaries. If you're unsure of what's expected of you, or when different stakeholders have conflicting expectations, the resulting tension can become a significant stressor. And I worked with a clinician who was a lead in her organisation who was torn between administrative demands for cost cutting and clinical responsibilities to provide optimal care. And then this role she had, the role conflict, created a state of sort of moral distress that eventually led to cynicism, which is another key component of burnout. So getting clear on the role that you're in and addressing if there's any conflict you notice in the role that you have. And the final workplace point that I want to raise around psychosocial safety in the workplace definitely is a workplace burnout risk factor as well. There's so much overlap here. Lack of recognition and reward. And as healthcare professionals, we often work in systems where exceptional effort goes unnoticed while mistakes are highlighted. It's that really tricky balance of complaints being given or complaints being made more quickly than reward and acknowledgement being given on the daily. And this really can create a culture where people feel undervalued despite giving their all. And I would say, what does recognition look like for you? It might not be just about formal awards or financial incentives. Often it's the day-to-day acknowledgement of contributions that matters the most. And when this is missing, motivation and engagement gradually erode. And we see that in burnout where people disengage from their team and they're a lot quieter than the person they ever used to be. So how can you build reward into your workplace day? Like acknowledging those around you. And also it's okay to acknowledge yourself as well and go, I had a really difficult conversation. I didn't run away from it, or I heard what was going on from the other party and we gave space and time to have that conversation. So yeah, really getting clear on what reward can look like for you other than sure, the financial reward that you might have for going to work, it might not be about that for you at all, though. I want to share with you a personal reflection, something that went on a few weeks back. It was actually over the weekend that I attended the Psychosocial Risk Factors in the Health Workplace conference. And I experienced 5 consecutive days of things that I found psychologically more triggering than usual. And by day 5, I noticed I was being reactive, I was almost hypersensitive, and I even felt a tinge of shame. How could I still be feeling this way despite all the work I've done on myself? And I can tell you it was a bit of a journey, and I'm so grateful for my support systems that I have around me who I can talk through this with. My husband was actually away doing a locum elsewhere, and so I sort of didn't have my primary support person around at home as I normally do. But I paused and reminded myself, as you are, as we all are, we're humans with a human brain, and we all experience a roller coaster of emotions in response to different triggers based on our life experiences. And this self-compassion was so crucial in helping me reset. I wanted to share this with you today because I want to reassure you that even as a burnout recovery coach, I'm not immune to these challenges. The difference is in sort of how quickly we recognize what's happening and the tools that we use to respond. And so, as I say, I reached out for support from others. I definitely moved my body. I worked on my sleep, although I can tell you my sleep was affected by these almost heightened emotions and a bit of a drop in a sense of psychological safety for a few days. And I also had mindset coaching with my coach, as I have on the regular, and definitely brought this up there. So that's sharing with you some of the tools I use to respond. So when we're summarizing individual and workplace risk factors, it's important to understand that burnout results from the interaction between the workplace factors and the individual vulnerabilities. On the individual side, this might look like perfectionism, difficulty setting boundaries that can be linked with people pleasing, and also high levels of empathy and sort of that very giving nature that so many people can be without corresponding self-care that can increase your susceptibility to burnout. Yeah. However, I want to emphasize that burnout really is primarily an organizational problem. Like 80% is meant to be to do with the organization and 20% contribution from the individual. And organizational solutions are what we really need here. Individual coping strategies are important, but they're insufficient if the underlying workplace factors remain unaddressed. So even if you try and do whatever you can for yourself, knowing your tendencies and so forth, if you continue to be in a workplace where there are these risk factors for you, you might not get full resolution of that burnout recovery in that workplace. So let's think about what we can do. For organizations, it's important to identify specific risk factors in your workplace through surveys or focus groups and also exit interviews. So I know we have an annual People Matters employee survey that we do through the local health district. I haven't left health recently, so I haven't had an exit interview, and I'm not sure how often that does happen, but I'm sure people are invited to do that. Secondly, implementing workload management strategies. So this might include reviewing staffing models, streamlining the administrative tasks, or providing additional support during high demand periods. Thirdly, increasing job control where possible. I think it's great to think about two circles where the outside circle is your circle of concern, and then your inside circle is the circle of control. So think about where in your job do you have control. This is more of a personal thing rather than organizational, but if you can work out where you do have some control in your role, that can really feel quite empowering and that you have some agency there. Foster a culture of recognition, create formal and informal ways to acknowledge contributions and celebrate successes, no matter how small. And provide leadership training. So ensuring that managers understand the impact of their behavior on team well-being and that they have the skills to create psychologically safe environments. And often in healthcare, we can find ourselves in a leadership role without necessarily having had leadership training. I think it's a great boost to your confidence and to maybe to your behaviors as well as a leader in the workplace. Finally, 5 points for individuals. So recognize the early warning signs and be familiar with your personal indicators of stress and burnout. For some people, it's irritability. For others, it's withdrawal or physical symptoms. Secondly, set and communicate boundaries. Clearly define what is acceptable and what's not in terms of workload, availability, and responsibilities. Thirdly, build your support network. Connect with colleagues who understand your challenges and can provide both emotional support and practical advice. Yes, that might be attending a Schwartz round and find that you connect with somebody else in the audience who's had a similar challenge that they may have got through. It may be getting supervision as well, whether that might be an option for you, or mentorship as well through the workplace. Fourthly, practice self-compassion. I talk about this a lot. Treat yourself with the same kindness and understanding you would offer a friend or patient facing similar challenges. And finally, seek professional support, whether that's coaching, counselling, therapy, or your employee assistance program. Don't hesitate to reach out for help when needed. So as we round out this podcast episode, I want to highlight that understanding psychosocial risk factors is the first step towards creating healthier workplaces and preventing burnout. We can't always change our work environments overnight, but awareness does allow us to be more strategic in how we might navigate these challenges. Remember, experiencing stress in response to these factors doesn't mean you're weak or unsuited to healthcare. It means you're a human and you're responding abnormally to pressures, but when those pressures become long-term or chronic or unrelenting, that's when the stress levels are raised for a long time, and that can turn out into burnout. So I'm here to remind you that you're not alone on this journey, and until next time, take care of yourself. And remember that addressing workplace factors is essential for sustainable burnout recovery. Thank you so much for listening to this episode. I'll be back again next week. Cheers. Thanks for listening to this episode. Schedule a 60-minute power hour with me and leave with relief, decisions made, and clear next steps. Or send me an email for a speaking inquiry. All information is available at drjobraid.com with links in the show notes.